needing a joint replacement? Maybe you're dreading the process or the recovery. Well, according to Community Medical Center doctors, you don't have to. We talked to one patient who says new knees changed her life.
Hello, Layla.
Layla Thomas first came to see Dr. Dennis Basil 3 years ago.
I felt like my world was coming to an end.
At the time, she was working 2 jobs, both physical in nature.
It took everything that I had to do that, all my body mechanics, and they weren't working properly.
The pain forced her to quit. She also was going to school.
And walking across that campus was just really, really impossible.
And eventually had to quit that too.
I could not complete anything that I started.
Basically, all these people, they come in with severe pain, they can't walk, they can't even sleep at night.
Dr. Basil, with offices at the Clovis Community Campus, knew how to help.
90% of these should last about 20 years, so you should get some good wear and tear out of it.
He says the biggest cause of joint problems is from arthritis. It's the loss of the smooth joint surface called cartilage. Once it's gone for good.
The joint base becomes bone on bone, where it just grinds, pops, crackles, and causes a lot of pain. And it causes deformity and swelling, and the patients just can't walk anymore.
Dr. Basil can replace it, but he says a lot of his patients aren't sold on the idea at first.
What are the biggest complications? Because they hear all these horror stories where someone gets infected and they lose their leg, and so people don't want that to happen, obviously, and I calm them with that too. We always prepare these patients. We get them on a diet program to lose weight. We get them to stop smoking. We get their diabetes under control, so we can all control all these factors that increase infection.
And recovery takes time.
You have to dedicate like 3 to 6 months of rehab after the surgery. Either you got to do physical therapy, you got to walk, you have to move the knee, elevate, ice.
But he says it's all worth it.
Their biggest reward is just doing daily activity without pain.
It brings tears to my eyes because I did not expect this kind of improvement so fast and so it felt wonderful.
Layla had her left knee replaced in September 2014.
How far can you bend?
Then did it again on the right side 6 months ago.
I feel like if I could break dance for you, I would do it. I mean, and don't tempt me.
She says now she's got too much to accomplish to deal with that kind of pain ever again. In fact, this fall, she's headed back to school full-time to finish what she started, with brand new knees and a brand new spirit.
20 years.
Thank you for giving me my life back.
It's not just knees that can be replaced. Doctors at Community do hips, shoulders. They can even do a redo replacement if you're having problems. Coming up on Medwatch today, we're mixing it up in the kitchen with a healthy way to enjoy all the flavors of summer with a South American twist. Plus, precious moments caught on camera. A look at our future generations just born at community medical centers.